Let me ask you something honest. How long have you been walking for your health? Maybe years, maybe decades, every morning, every evening, rain or shine, and you are proud of that. You should be. But here is something nobody has told you clearly. Walking is good for your heart. Walking is good for your mood. Walking is genuinely valuable. But walking alone is not stopping what is happening to your body after 60. And what is happening to your body is not something you can afford to ignore. Today we are going to tell you exactly what walking is not doing, what you need to add instead, and why the seniors who make this one change feel stronger, steadier, and more capable within just 8 weeks. No gym, no expensive equipment, no getting on the floor. Stay until the end, because the last movement we show you is the one that research says predicts how long and how well you will live more than almost anything else. Welcome back. First, we are not telling you to stop walking. Walking is genuinely good. Keep doing it. But for decades, the advice given to seniors was simple. Stay active. Walk regularly. That is enough. And that advice, while well-meaning, missed something critical. Mounting clinical evidence consistently shows that muscle mass, balance, and functional strength are better preserved with resistance-based exercise, and walking alone cannot prevent the physical decline associated with aging. Walking does not challenge your muscles enough to maintain them, and after 60, muscle loss is the hidden enemy behind almost every quality of life problem seniors face. Falls, weakness getting up from chairs, difficulty on stairs, feeling unsteady, losing independence. These are not caused by old age. They are caused by lost muscle, and walking alone will not bring that muscle back. Here is what is happening inside your body right now. Many exercise programs designed for older adults emphasize light activity, gentle walking, or chair exercises with minimal resistance. While these offer some benefits, they typically do not provide sufficient stimulus to reverse age-related muscle loss. Muscle loss, called sarcopenia, begins quietly in your 40s. By 60, it has accelerated. By 70, it is one of the most significant factors affecting your daily life. And the research is very clear about what stops it. Resistance. Challenge. Asking your muscles to work against something harder than they are used to. Not brutal gym workouts, not heavy weights, not anything that risks injury. Just specific movements that ask your muscles to push, pull, and hold against resistance regularly. Research demonstrates that older adults can safely perform and significantly benefit from resistance training. The misconception that older adults should avoid challenging exercise actually accelerates muscle loss and functional decline. Here are 5 movements. No gym, no equipment, just your body and a chair. Movement 1. Sit to stands. Sit on a firm chair, arms crossed over your chest. Slowly stand up fully, then slowly sit back down, controlled all the way. Do not drop into the chair. Start with 5. Build to 15 over several weeks. Research-backed protocols do not require gym machines or heavy weights. In most cases, bodyweight movements and stable household furniture provide enough resistance to achieve measurable outcomes. This one movement directly rebuilds the thigh and hip muscles responsible for getting up, walking confidently, and preventing falls. It is the single most important movement for senior independence. Movement 2. Wall push-ups. Stand facing a wall, hands on the wall at shoulder height. Slowly bend your elbows and bring your chest toward the wall. Push back. 10 repetitions. This builds the chest, shoulder, and tricep muscles, the muscles that catch you when you stumble, the muscles that push you up from low surfaces. Movement 3. Heel raises. Stand behind a chair holding the back lightly. Rise up onto your toes. Hold 2 seconds. Lower slowly. 10 to 15 repetitions. Your calf muscles are the pump that pushes blood up from your legs back to your heart. Calf muscles are among the first to shrink and weaken with age, affecting how well we walk, balance, and even stand. This movement maintains them directly. Movement 4. Seated leg raises. Sit in a chair. Slowly lift one straight leg to hip height. Hold 3 seconds. Lower slowly. 10 each side. This targets the quadriceps, the front thigh muscles, which are directly responsible for climbing stairs, getting up from chairs, and walking without wobbling. Movement 5. Standing hip hinges. Stand behind a chair. Hold the back lightly. Slowly push your hips backward, as if you are going to sit but stop halfway. Hold 2 seconds. Come back up. This works the glutes and lower back, the muscles most seniors have completely lost strength in. Rebuilding these muscles directly reduces lower back pain and dramatically improves stability. Now the last movement we promised, the one that research says predicts longevity. It is called a balance stand. Stand behind a chair, hold it lightly, Slowly lift one foot off the floor. Try to balance on one leg for 10 seconds, then switch. The better our balance, the less likely we are to fall, and falls are a leading cause of injury and loss of independence in older adults. Studies have shown that the ability to balance on one leg for 10 seconds in adults over 60 is significantly associated with survival over the following decade. Not slightly associated, significantly. If you cannot do 10 seconds today, that is fine. That is exactly why you start practicing now. Within 4 to 6 weeks of daily practice, most seniors reach 10 seconds. Some reach 30. Your balance is trainable at any age, and training it may be one of the most important health decisions you make this year. Here is your simple plan. 5 movements, 3 times a week, 20 minutes. Sit to stands, wall push-ups, heel raises, seated leg raises, hip hinges, and 1 minute of balance practice every single day. That is it. Participants in recent clinical programs reported greater walking confidence, reduced dizziness, and improved stair climbing ability after just a few weeks of resistance-based training. Keep walking. Absolutely keep walking. But add these 5 movements to your week. Within 8 weeks, your legs will feel different. Within 12 weeks, the people around you will notice. Share this with someone who walks every day and wonders why they still feel weaker than they used to. Subscribe for a new simple health video every week. We will see you next time.